Thank you very much, Director Whitehorn, and thanks all of you for coming this morning. Good morning, everyone. And
Good morning.
I am very pleased to join you today as we discuss medical debt relief for Illinoisans. And I'm here with some of the fiercest advocates for the people of Illinois, and especially those who've suffered under the weight of medical debt. I won't reintroduce them. You've heard from Lizzie, from Director Whitehorn about them, and so I won't repeat their names. Just to tell you, though, that John Cook has been a beneficiary of Cook County's debt relief program, and he's going to share his story with you in just a few minutes. I really am grateful for the work that gets done at the Department of Healthcare and Family Services. They carry a large portion of not just the budget of the state of Illinois, but the responsibility for so many families across the state. And Director Whitehorn's leadership has just been outstanding. As many of you know, healthcare debt is a uniquely American issue. Across our nation, individuals and their families are forced to reckon with near impossible financial choices as the price tag on healthcare continues to increase. And when an emergency arises, the cost of care is not an optional expense. Well, we all want our loved ones to heal quickly and for ourselves to heal quickly. We want the best and safest options. We want a fair shot at a healthy life. But after the care ends for that circumstance, many walk away with unexpected pain. Not only the emotional and physical toll of the crisis that they've been through, but a serious financial toll too. Too many patients leave hospitals with their credit ruined or at risk of bankruptcy in the ensuing months. Often through no fault of their own, all because our health insurance and our healthcare billing systems are a little bit broken. Over 100 million Americans, nearly 1 in 3, struggle under the duress of medical debt. And here in Illinois, 14% of our population has medical debt in default. On top of that, we see significant racial disparities, with nearly 20% of communities of color in Illinois experiencing extreme medical debt. It's preventing individuals and families from attaining financial stability, and research shows it's also having day-to-day impacts for all the affected individuals, like emotional distress and difficulty meeting basic needs. Even worse, many people affected by medical debt end up completely foregoing medical care that they need while dealing with the burden of past unpaid healthcare bills. It's long past time for us to make a change. Cook County Board President Toni Preckwinkle recognized this before many of us, and she has led the charge to find a solution. It's a partnership with a national nonprofit that's recently changed its name to Undo Medical Debt, which has been on a mission to end medical debt across the nation. They got off the ground in 2014 with the help of philanthropists and some media companies, and they've since been wildly successful in places like Cleveland, Ohio, Oakland County, Michigan, New York City, Arizona, and right here in Cook County. So far, Cook County has abolished more than $348 million in medical debt for over 200,000 Cook County residents since 2022. So in February, during my budget address, I proposed that we take this initiative statewide. At a cost of around a penny or so for every dollar of medical debt we eliminate, we have the potential to eliminate billions of dollars of debt and help millions of Illinoisans. In the first year alone, I've proposed investing $10 million to relieve nearly $1 billion of debt for 340,000 Illinoisans. And in the coming years, I'm proposing we eliminate medical debt for over 1 million Illinoisans. I'm pleased to say others are joining us in this fight. Just this week, Loyola Medicine announced that they are forgiving over $112 million in medical debt for past and current patients. This act of generosity will help more than 60,000 Illinoisans. I want to thank Loyola Medicine on behalf of all of Illinois. Working together with members of the General Assembly on this, we continue to negotiate and pass a balanced budget. And this low-cost program to eliminate medical debt will alleviate a major burden on families across Illinois. So I want to thank Senator Simmons, for sponsoring this important legislation and leading the charge on making this bill a reality. Together, we can improve financial security for those who need it most, and we can continue Illinois' record of leading by example by becoming one of the first states in the nation to eliminate the burden of medical debt for hundreds of thousands of our residents, and ultimately over 1 million. With that, I'd like to turn the podium over to a leader for working families, a friend, and someone who is a tireless champion for people who are underserved and who need this medical debt relief, Cook County Board President Tony Preckwinkle.
Thank you, Governor.
You bet.
Good morning, everybody.
Good morning.
I'm grateful to be here for this announcement that will bring relief to thousands of households across Illinois. I want to thank Governor Pritzker for the invitation to join him, and I want to acknowledge the leaders, partners, and participants who are here today. Thank you for all your good work and support. And Governor, I want to thank you for your partnership across a variety of issues that impact the people of Cook County and the state of Illinois. I applaud today's announcement because it represents a return on investment for residents who need help the most. It's also a proven model, both around the country and here in Cook County. Using federal funds through the American Rescue Plan Act, Cook County has successfully acquired and erased $348 million in debt and benefited 200,000 Cook County residents, with more to come. We're proud of providing this relief to residents because we know that medical debt is a growing problem nationally and locally. Nationally, a recent survey from the Census Bureau shows that Americans owe at least $220 billion in medical debt. Hundreds of millions of debt is held in Cook County alone. And of course, as is true with most issues of poverty and marginalization in this country, people of color are disproportionately impacted. Nationally, Black adults are 50% more likely, and Hispanic adults 35% more likely to hold medical debt compared to whites. Medical debt is now the leading cause of bankruptcy in the United States. It can also lead to poor credit, which undermines employment prospects and the ability to access affordable housing and ultimately achieve upward mobility. We've also heard directly from our participants that medical debt imposes psychological burdens. Cook County Medical Debt Relief Initiative participants have told us that of the stress and depression that bills caused when they arrived in the mail. They also told us about the relief and gratitude they felt when they finally had their debt abolished. By providing relief to our residents, we're lifting a heavy burden. Families, finances, and futures are changed by giving people a chance to clear up their debts. And we're already seeing the impact. I look forward to hearing more about that impact from John shortly. We're proud of the work that's being done, but this is just the beginning. Governor Pritzker's commitment to this work will expand our reach across the state. Hundreds of thousands of residents stand to have hundreds of millions of dollars of debt abolished. And we look forward to continuing the good work to provide more relief to Illinois communities that need help the most. Let me just say, what we need in this country is universal health care, but we don't have it. So those of us who believe that have to do everything we can in our power to take us down that road a little bit, and relieving medical debt, along with the expansion of Medicaid coverage, which occurred under President Obama, are great steps along the road to providing health care for everyone, which is what the richest country in the nation ought to be doing. Now, it's my pleasure to introduce John Cook, a Cook County resident. John Cook, a Cook County resident, where are you? Who's had his debt abolished under the Medical Debt Relief Program. John is prepared to tell his story for us. We thank him. Thank you, John.
Thank you, President Preckwinkle, and thank you, Governor and Director Whitehorn, as well as all of you all. I'm flabbergasted. I just can't believe I'm up here because I didn't expect the governor for sure to be here, and it's like God really has a sense of humor. So I want to thank God, first of all, for even allowing me to be here today to survive a emergency heart dissection surgery. And here I am now, some 14 years later, before you. So I'm blessed, all right?
Hear,
Before
hear.
I even came up here, I'm blessed.
Hear, hear.
But I'm even more blessed by this program, obviously, because yes, it has relieved me of so much stress and tension and heartache. And I must tell you, when I received the letter, I said, this isn't nothing but a scam, you know, because we all get letters like this, right? And we know that usually they're a scam. How often do you get a letter and it's for real and it says, I'm going to forgive so much money, right? And I'm like, this isn't real. So I was in between moving. I'm a product of a marriage dissolution. So I was moving from Bronzeville to Lincoln Park now, where I am. And I put the letter off to the side and I said, I'll get to it later because, again, I thought it was a scam, but I was hopeful. So when I looked at it again later, I matched it up with the account numbers. I matched it up with the cash amount and where I had my hospital service. And I said, this could be legitimate. And so in the meantime, I got a letter and it asked if I wanted to share my story about, you know, what I went through. And I was like, okay, I think I could do this, you know. As I said, I was going through a divorce, so that's in itself is a lot of stress, right? And then having to deal with losing insurance as a result of that divorce because my ex-spouse was the one who carried the insurance. So now here I am, an independent contractor, an entrepreneur without adequate insurance. Now, it's nothing I can worry about, right? Because I didn't anticipate this, but at the same time, I had to put it in the back of my mind. And while putting it in the back of my mind, obviously I'm dealing with stress that even I don't know what I'm dealing with. So it was something that really compounded just the divorce and everything else. So in addition to that, when I was in this wait period or gap period, I get this phone call from a potential insurance provider, and I'm like, yeah, I need insurance, so let's do it. So I sent them a big chunk of change to get a premium, and they ended up being a scam. Okay, and so I tried to get my money back after I canceled, and it wasn't too far into the program that I had, so I was due some partial payment on my premium, which never came. And ironically, over the last couple of weeks, I've received contact from this same company again, knowing that I've canceled, but yet asking me if I would reconsider coming back, and I can't believe it. Either there's some kind of disconnect or they're just that stupid. But I am just delighted to be here, and I tell you why. Because it's been touched upon, but there are countries all over this world who have free health insurance. And there's only 43 countries that do not, out of nearly 200. So why we, the U.S. of good A, aren't offering the same type of thing when we tout how rich we are and we're just the greatest country, I don't get it. I don't get it why we're not matched up with lesser knowns, if you will. Okay, so I think that is just great work, President Preckwinkle, that you've begun, and now it's inspired by Governor Pritzker as well, and this is the direction we should be going in. This is what God wants, and why we can't do what others been doing for some time is unbeknownst to me. So I'm truly excited. I want to thank everyone on behalf of all the donors who haven't had this opportunity. I want to also thank those who have donated to make this successful, those who are, of course, known and unknown. And again, I want to thank all of you all for allowing me to tell my story and this wonderful group up here. And with that said, I want to ask to have come up here Mr. Sean Vincent.
Good morning, and thank you for joining us today.
Good morning.
I am honored to represent Loyola Medicine, a regional academic health system in Chicago's western suburbs. Loyola Medicine is deeply committed to providing access to high-quality healthcare services with compassion, dignity, and respect, especially to those in our communities who are underserved or facing financial hardship. Unfortunately, far too often, even low levels of medical debt means families across the country are unable to access the care that they so desperately need. A survey by the Kaiser Foundation showed that Americans with medical debt are more than twice as likely as those without debt to postpone or even skip seeking healthcare services because of the cost. Today, I'm pleased to announce, as the governor stated, that Loyola Medicine will relieve $112 million in medical debt, which impacts over 60,000 individuals. This initiative underscores our dedication to alleviating the burden of medical debt on our patients and the communities that we serve. We have identified accounts that meet specific criteria. Amongst some of those requirements, they're older than 2 years old. They belong to individuals who either earn at or below 400% of the federal poverty level, or whose medical debt even exceeds 5% of their annual household income. I want to commend Governor Pritzker for his leadership in addressing the root cause of medical debt throughout initiatives such as the Health Care Protection Act. Illinoisans must have protections to alleviate the financial strain of healthcare costs. Together, we are taking meaningful steps towards ensuring access to health care and economic stability for all community members. I would now like to welcome the President and CEO of the Shriver Center on Poverty Law, Audra Wilson.
Good morning, everyone.
Good morning.
And it's an honor to be here, and thank you, Governor, of course, for this amazing initiative. Obviously, at the Shriver Center, health equity has been one of our primary areas of focus as we seek to address barriers of accessing quality health coverage. But obviously, thinking about medical debt, this is another very major issue. I'm not only here as the president of the Shriver Center, I also happen to be the chair of the Illinois Commission on Poverty Elimination and Economic Security, appointed by Governor Pritzker, and also chair of the Cook County Commission on Women's Issues with President Preckwinkle. So this is an issue that we think about, we talk about much at different levels. And obviously bringing up the rear, I'm just reiterating the same points that have been made, but they do need to be repeated. And you've heard this over and over. This is not just about medical debt. It's about undermining social conditions for people for improving public health. We're talking about medical debt that contributes to food insecurity and housing instability. And as you've heard over and over, this possibility of discouraging people from seeking essential medical care and prescriptions. So this initiative is so important because medical debt sometimes can be disguised. It's not visible all the time. It can be masked as other forms of debt when people use a regular credit card, for example, to make medical debt payments. So sometimes not even realizing all the different ways in which people have incurred and are trying to pay that debt. This is why this initiative is even more important. And it's also not just harmful to people with low income. We're talking about households with health insurance, and even middle income struggle underneath the weight of medical debt. It is crushing. It is massive, and that is why this initiative is so significant. And Sean, Loyola's initiative being so significant as well. One other thing I just want to point out, what's interesting at the Shriver Center, we've worked very closely, especially with President Preckwinkle, with the Promise Guaranteed Income Pilot Program, which is meant to help families with money that they're able to use to apply to their households with no strings attached. Imagine that this money that was meant to supplement these households are also being used to pay medical debt. But now this frees up their ability to use the money in a way to really benefit their families and move them forward. This along with the Chicago Guaranteed Income Pilot Program. So I do want to mention that as well, because these families are struggling mightily with rising costs, with inflation, with costs of all sorts of goods and services. So to imagine that they have the ability now to have medical debt erased is so significant. So thank you so much. And with that, I'm going to bring back Governor Pritzker.
Happy to take questions from members of the media. Yeah, Olivia.
Thanks, everyone. I saw that there was a study earlier this month that the New York Times wrote about on medical debt. Said that it did improve certain aspects, even though anecdotally some people said that it did. Did that cause you to pause at all on this, or have you seen that study? Have a reaction to it?
I read about it. I know it was written about. I can say that first of all, that study was done, as you know, in 2018, 2019, 2020, and a lot has changed. You know, as I mentioned earlier in my remarks, the organization Undo Medical Debt has done a lot to change their program. They started out as a startup back in 2014 and got going really more significantly in 2016. And then as the pandemic hit, there was even more opportunity and different ways in which you could alleviate medical debt for people. And so now here we are in 2024. The program has evolved even more. So I think the results of that are not indicative of, for example, the results of the research that's been done since then. There are lots of research items. You could go on the Undo Medical Debt website and see all of the different research that's been done to alleviate stress for people, which is what eliminating medical debt does, to increase people's credit scores so that they can go out and rent an apartment or get a credit card or do things that they weren't able to do before. So there has been a lot of improvement in the program, and we're really pleased to continue the progress. And I think you've also seen that very few states have really gone after this. It started at a very local level in small towns and cities, and then it's moved to counties, and finally, you know, one of the largest counties in 2022, and here now one of the largest states in the country, in fact, the largest state to take this on so far here in Illinois. Yeah. Craig.
Off topic, if you would. The state as well as the county have made the commitment to the funding to help with the migrant crisis. Today, a city council committee, and then on Wednesday, the city council is expected to vote on appropriating $70 million from their reserve funds to meet the amount of money that the two of you had hoped that the city would commit. Have you had any conversations with the mayor, or has your staff talked to his staff about that? And do you have any concerns that some members of the city council could balk at this and want to see the money spent to other needs that the city has?
Look, there are people, you know, who hold office in Illinois who don't think that we should care for the people that are being shipped here by the Texas governor, that we should just let them wander around homeless with no food, with no medical care. They're just people who believe that, and I'm not suggesting that any particular members of the city council believe that, but I know there is just generally a feeling like, hey, it's our money, we should, you know, apply it to the people who've lived here for a long time. But the reality is that it's much better for the city and for the state if we provide just basic humanitarian care for people who arrive here. And so we're attempting to do that, and I know that the mayor is committed to this. Certainly the president of the Cook County Board is committed to it, and I am. You know, I'm hopeful, and I think I'm optimistic that the city council will commit to this. It's the right program. By the way, the state is taking more than a majority of the cost on, and so collectively, this kind of partnership is the right way to go for the taxpayers. It's the right way to go for doing what's right for the new arrivals in Chicago. And I'm proud of the work that the volunteers and the people on the ground are doing just to provide these basic humanitarian needs.
President Pritzker, could we ask you just to weigh in on that? Have you had conversations with the mayor and or, you know, any work that you're doing to help them get over the hump, if you will, and get this money approved?
Well, the first thing I should say to follow on what the governor said, you know, I'm not a student of comparative religion. I'm a history teacher, but I don't know any faith tradition that doesn't say you shouldn't care for the people, strangers who come to your door. So I'm going to thank the governor for his steadfast support of our new arrivals and my own commissioners. I spoke with each of them prior to the public announcement of the partnership between the city, the county, and the state to try to provide more resources for new arrivals, and got an overwhelmingly positive response. So I'm grateful to the governor for his leadership. I'm grateful to our commissioners for their support for a county investment in new arrivals. I know that there's a vote at the Budget Committee, I think, at 2 o'clock today, and I hope the matter comes out of committee and is taken up on Wednesday.
What kind of response, though, I understand you did speak to Aldermen over the weekend, and not all of them are on board, but what was your method of trying to convince them that this is a good vote?
Well, I said some of the things I just said here. And I talked to people who are my colleagues in the city council when I served there for almost 20 years, and shared with them that the county was prepared to step up, and the state, of course, and hopefully they would as well.
Governor, could you also talk about what's going on at O'Hare this morning? And I'm sure because you've been here doing this, but there's been a rather large protest. People have had to literally walk from the highway up to O'Hare because of the Palestinian protest, and it seems to be perhaps a preview of what we might see for the DNC this summer.
Well, first of all, I support the idea that people should, express their First Amendment rights and protest if they would like to. I do not think that they should be disruptive of the traffic of people trying to get from one place to another. I think they can have their voices heard and let people move along their day. And I'm convinced that law enforcement ought to make sure that those byways and highways are open for people and still be respectful of those protests.
Are you concerned people are going to watch this tonight and say, I'm out of here this summer when that DNC comes, because look what's going on already today?
Look, there are protests at every convention, I have to say, at every 4 and 8 years. And so I don't think it's any surprise to people that there would be protests. They come in all shapes and sizes. And I don't think that anybody's unfamiliar with the protests that have occurred as a result of the Israel-Hamas war. But I do think that, again, we got to make sure that at all times that people are able to get where they want to go while at the same time respecting the people who are protesting. Yeah.
Some of the groups that are wanting to protest at the DNC are saying that the permitting process is unfair, it's limiting on free speech. What do you make of that?
As you know, the state's not in charge of that permitting process, and again, I respect people's right to protest. I also respect people's right to come to the convention and be able to get where they want to go without having to be greeted with people yelling at them as they're walking to the convention hall. Having said that, again, First Amendment rights are immutable, and we ought to be protecting those wherever we can.
We can do one more. Governor, do you have any update on the planned rebuild of Stateville and Logan Correctional Facilities?
I don't think there's any update that you're not aware of. There will be hearings. That's part of the process when you're trying to close down or rebuild a facility, these kinds of facilities. So there'll be public input in both of those communities, and then of course the legislature itself will be weighing in on the investment in those new facilities. But let me be clear, we have to replace those facilities. I mean, this is not like an optional issue. There are lawsuits that have been brought to court in Illinois, decisions that are pending that would require likely the closure or replacement of those facilities. So we want to get ahead of that and make sure we're doing the right thing. This should have been done, frankly, many years ago. And it's been put off because of the lack of resources. Now we have the resources to do it, but we shouldn't have waited even this long. It's the right thing to do now for the safety of the correctional officers and the safety of the prisoners.
All right, thanks everybody.
Thank you.